So first of all, I just wanted to say, as soon as I joined this morning and saw you two sitting next to each other, I felt so much joy and happiness, and I had a big smile on my face. Um, uh, Dr. Yamamoto is one of our one-year fellows. She joined us last fall and is about halfway through her fellowship. She graduated from the Monroe Family Medicine residency program in Wisconsin. She is a DO and has brought many of her osteopathic skills to our integrative family medicine clinic as well as to our consult clinic, um, and has shared that wisdom and knowledge with many of us here in our department. In addition, I've had the pleasure of spending extra time with her at many adventures through Mindfulness for Your Health group medical visit, through the Healer's Art class at the medical school, and mindfulness elective in the medical school. And just I'm grateful for Dr. Yamamoto's curiosity and willingness to learn and partnership together as a fellow. And Dr. Shah, who has in our um, two-year integrative medicine fellowship and graduating this year, and uh, he completed residency here in our family medicine department at the Wingara Access Clinic, and continues to work there as a preceptor during fellowship. Um, I have, I think, one of the most, in addition to all of the work that Jeremiah has done, taking a deep dive into osteopathic medicine, um, being willing to dive into some presentations, including this one, head first with a lot of creativity and open-heartedness. I've always found with Dr. Shah um, an appreciation for being himself and bringing his whole self to each encounter, and that has consistently shown up in feedback that I've received from patients that he's seen in clinic together. Um, and I'm so grateful for your partnership and your presence here with us, Jeremiah. So with that, I will pass this over to you both.
Awesome. Thanks, Vinny. That was lovely. Yep. Right. All right. Awesome.
Everyone can see the screen and hear us okay?
Yep, that looks great.
Okay. So good morning, everybody. Thank you so much for the really nice introduction. Our presentation today is From Health Crisis to Healing Journey, Navigating an Increasingly Isolated World to Rebuild Community. Today, we'll be talking about loneliness and social connectedness, learn the impact of these things on our physical, mental, emotional health. We'll also briefly touch on the COVID pandemic and how that kind of exacerbated sort of loneliness and sort of brought it to public awareness. And then we'll explore ways to talk about and identify this in patients and explore ways to sort of address it as well. We wanted to briefly acknowledge that UW-Madison occupies ancestral Ho-Chunk land, and so we wanted to sort of respect the sovereignty of the Ho-Chunk Nation along with the 11 other First Nations of Wisconsin. We also just wanted to thank Dr. Minnie Kielo and Dr. Kufal for giving us this opportunity to present and for always being our teachers. Neither Jeremiah nor I have any financial disclosures. So we'll just get right into it. So in this brief patient example, this is a patient that Jeremiah had actually seen. So a 72-year-old female who had come to the consult clinic for some chronic knee pain. Pretty typical of the patients that we see. She had failed conservative management for her pain other than surgical interventions, which she wasn't very interested in. She was a fairly healthy 72-year-old with some hypertension, osteoarthritis, depression. As sort of part of the intake, she had said that her husband had recently passed away. She had to downsize from her home and move across town. She was previously involved in her church community. She would actually just walk to her church every day, but now she can't really, get to the church that she was previously with, and she didn't really have anything locally nearby. So as we sort of go through our presentation today, we would invite you to think about what impact does social isolation and loneliness have on her health-related outcomes, or maybe if you've had a particular patient that you've seen before that might sort of resonate or seem similar to this example, think about them through our presentation today. So this presentation had actually kind of stemmed from the General Surgeon Advisory that was released May of 2023 by Dr. Murthy, the U.S. Surgeon General. This had kind of brought to the attention, like the public health crisis of loneliness, isolation, and lack of connection. So the general advisory reviews sort of the extent of the problem of loneliness, especially kind of within the US, the implication on health, how we can combat this issue at multiple levels. And so a lot of the figures from my part of the presentation will draw from that. But I would invite you to sort of read it if you wanted sort of a deeper dive into this topic. So some definitions to sort of start off with, which we drew from the General Surgeon Advisory. Loneliness is a subjective, distressing experience that results from perceived isolation or inadequate meaningful connections, where inadequate refers to the discrepancy of unmet need between an individual's preferred and actual experience. Social connection, which is a continuum of the size and diversity of one's social network and roles, the functions these relationships serve, and their positive or negative qualities. And social isolation, objectively having few social relationships, social roles, group memberships, and infrequent social interaction. There can be a lot of nuance to these definitions, so this is sort of just a few among many. But these are kind of the basic ones that we'll draw from throughout our presentation. And one thing I do want to point out is that, individuals can have a relatively isolated life, but not necessarily feel lonely. You can also have a lot of social contacts, but also still feel lonely. So social isolation and loneliness kind of show a degree of social disconnection, but they're not necessarily the same thing. So within social connection, there's three components that we can think about: structure, function, and quality. The structure involves the number of relationships and the frequency of interactions. The function involves the degree that the relationships are serving your needs, and the quality is the positive and negative aspects of the relationships. We can think of social connection as being on a continuum, not necessarily black and white or binary. Generally speaking, low social connection is associated with poor health outcomes, which is what we'll address later in the presentation. And social connection can also be dynamic. It can change over time. It's not necessarily static. I think for some of us who've went through medical school, we can certainly recall times when we'd be all by ourselves studying, not talking to anybody because it's just what you have to do, and it can be a fairly isolating and lonely time. But hopefully, those times are temporary. And in some ways, I think transient feelings of loneliness can be motivating for us to reconnect socially. But when we talk about low social connection and health outcomes, we're typically talking about sort of on a more chronic basis, like you're just in that state all the time. There's a lot of things that can influence social connection at multiple levels. Of course, on an individual level, your motivation, your ability, your access can influence how you connect with other people. But the infrastructure of the community can also have an impact. So like libraries, parks, volunteer organizations, public transportation, ultimately, those are influenced by social policies, technology, politics, and, of course, like from a broader sense too, people can be influenced by discrimination, inequality in the community, which changes a lot of opportunities for social connection as well. So while I think we like to think of it as an individual issue, it kind of plays a larger, there are things at large that can also influence it. And so in some sense, when we think about how we can influence someone's loneliness, yes, there are things on the individual level and relationship level that we can do. And that's mostly what our presentation will be about today. But at the community and health level, there are things that we can consider to sort of improve loneliness outcomes. This figure is also from the General Surgeon Advisory. I apologize, it's a little bit hard to read the graphs, so I had rewritten them on the left. But the 6 graphs show the trend of social connection from 2003 to 2020, so it's actually up to pre-COVID times. And by these indicators, a significant portion of Americans lack adequate social connection. Networks are getting smaller. Social participation has been sort of declining overall. In the upper left corner, that looks at the amount of time spent alone. That had gone from 285 minutes a day in 2003 to 309 minutes a day in 2019 to 330 minutes a day in 2020. So overall, an increase in 24 hours per month spent alone. Social participation, which is seen in the lower left, had also decreased from 60 minutes a day in 2003 to 20 minutes a day in 2020, an overall decrease of 20 hours per month. Not shown here, but another interesting statistic is that people from ages 15 to 24, they had found that time spent in person with friends had reduced by nearly 70% in over 2 decades, from 150 minutes to 40 minutes a day, from 2003 to 2020. Of course, the pandemic had kind of accelerated those things, and that's not even included in this graph. So I think with the pandemic, of course, everyone has kind of had their individual experiences with isolation, with loneliness. I think we can all recall in some form how life got put on hold in a lot of different ways, unable to see family, celebrate events, experiencing deaths of loved ones, but not being able to kind of spend time with family. Very interestingly, some of the surveys that were shown in April of 2021, I think sort of as expected, 1 in 4 people had reported feeling less close to family members compared to the beginning of the pandemic. But at the same time, 1 in 5 had actually felt closer to family members, which I think had shown that depending on what your family dynamics were before the pandemic had started, it had sort of exacerbated that. Additionally, from 2020 to 2021, some surveys were done that were gauging people's service and volunteering through the pandemic. And so for people 16 and older who had reported informally helping others, there was about 51% of people said they were doing that. So about 120 million people, which doesn't even include about the 60 million people who had formally volunteered in some kind. And so I think the pandemic has been a very interesting example of, yes, of course, like with social isolation and loneliness, but also how we were able to get through that time with service, volunteering, and creating our own ways of connection. And of course, if we mention the pandemic, I think we would also have to talk about technology in some way. Obviously, that had played a huge part in during the pandemic. And of course, this presentation wouldn't even exist without technology here. And right now, I think it's being used more and more. So I think 99% of people under 65, 75% of people over 65 use the internet. For Americans specifically, we apparently use digital media about 6 hours a day, which is a little crazy to think about. Social media use has gone from 5% use in 2005 to 80% in 2019. And so there have been a lot of studies that review loneliness and technology. There's a lot of kind of debate as to whether it's helpful or harmful. So some benefits of technology include fostering connection, giving opportunities to stay in touch with family and friends, giving another route for social participation for those who have disabilities, creating opportunities to find community. So especially for things like online support groups where you can share personal experience, receive support, and give social support as well. For some harms, if it replaces in-person engagement, that's generally not a great thing. If it dominates our attention, reduces the quality of our sort of in-person interaction. So, if you're eating at the dinner table together and everybody is on their phone, of course, that will sort of diminish the type of conversations that you may or may not even have. You wouldn't really be so interacting with each other in person. And in one US study, it was shown that people who had used social media for more than 2 hours a day had about double the odds of reporting increased perceptions of social isolation compared to those who use it less than 30 minutes a day. So in some sense, even though you're trying to, I think, make connections through social media, it can be isolating as well. Of course, another big potential harm too is that those who get harassed online, that can always, decrease your self-esteem and create more isolation for people as well. So who's at highest risk of social disconnection? Technically, anybody could really fall into this category. Of course, there are some groups that are going to be higher risk compared to others. Those with poor physical health or mental health, those with disabilities, financial insecurity, people who live alone, single parents, minorities, LGBTQ population, those who live in rural communities, victims of domestic violence. For older and younger adults, it's kind of interesting. Highest rates of social isolation are found among older adults, so usually those above 65, but young adults are almost twice as likely to report feeling lonely compared to that group. So if we think about the patient that we presented in the beginning, she's newly widowed, she had to move and change communities, she had some chronic, in some sense, a disability with her chronic knee pain that sort of limited where she can go. So we would kind of think about with her like, oh, maybe she is at risk for social disconnection. And now we'll go into a couple of specific health implications and how loneliness impacts disease. So to sort of start again from the General Surgeon Advisory, this figure was with a very kind of shocking headline. Lacking social connection is as dangerous as smoking up to 15 cigarettes a day. If you look at the other sort of health risk factors that are below it, there's cigarettes on there, drinking 6 alcoholic drinks daily, physical inactivity, obesity, air pollution. So it really does kind of, I don't know, impact health in a big way. Kind of on the flip side, there have been some studies that looked at how social connection can actually increase your odds of survival by 50%. So yeah, so these make a big health impact. And social connection can sort of influence our health in a couple of different ways. We can think about it from a biology perspective, psychology, and our behaviors, which can overall impact our health outcomes. There are some studies that look at inflammatory markers and social isolation and loneliness. It's not always completely consistent, but sort of broadly speaking, they have looked at how loneliness can increase your IL-6 markers, how social isolation can increase CRP and fibrinogen. And kind of, again, sort of opposite of that, social connection can also help with improvement in blood pressure, oxidative stress markers, better regulation of your neuroendocrine system as well. In terms of our psychology, social connection can influence how we think of our own meaning and purpose. So for instance, like usually, especially in the consult clinic, when we ask like, what do you want or need your health for? Most adults will say that, oh, for my family, for my close friends, those are the things that are really important to me. And those are motivating factors that can help you pursue health goals. And sort of kind of along the same lines as that, social connection can also help with our own behaviors. So if a loved one is telling you, hey, you should really check your blood sugar or take your medicines, you're more likely to do those things and be compliant. In kind of a much more broader sense, what social norms like, smoking is bad for you, can also kind of dictate how we pursue those health behaviors as well. And so if you're, again, like in a group where everybody is smoking, you are also more likely to smoke. If everyone in that group quits smoking, you're also more likely to quit. So the behavior within your social network can also influence what you're doing as an individual as well. So to go into a couple of specific disease outcomes, so to start with cardiovascular disease, poor social isolation, social support, and loneliness were associated with a 29% increase in risk of heart disease, 32% increase risk in stroke disease. The American Heart Association had also published a report in 2022 on how social isolation affects cardiovascular and brain health. And so from that, they shared that heart failure patients with high levels of loneliness had a 68% increased risk of hospitalization, 57% increased risk of emergency visits, and 26% increased risk of outpatient visits. Socially isolated adults also had a 40% increased risk of recurrent stroke, MI, overall higher mortality as well. For diabetics, if family members are involved in and support and help with your care, that overall improved their disease management for both type 1 and type 2 diabetics. Diabetic outcomes were better because there was improved medication adherence, improved physical activity, diet, foot care. And so kind of similar to what I was saying before, if there's like a larger social network size, that had helped with their management and therefore improved their mortality. For cognitive function, in the general surgeon advisory, they had said that social isolation and loneliness were linked with an increased risk of dementia. The two studies here has shown that there's an increased risk of developing dementia by 50% in older adults above the age of 50, and cognitive abilities were declining 20% faster among those who had reported loneliness. When I looked at the American Heart Association review, they ultimately concluded that some studies had shown a positive association with social isolation and loneliness, while other studies had no association at all. So I think it's not always necessarily a consistent finding among all studies. And then finally, with mood disorders, this can get kind of complicated because when we think about depression and anxiety and social isolation and loneliness, they can certainly influence each other. So if depression and anxiety can increase your risk of social isolation and loneliness because you're socially withdrawn, but also if you're socially isolated and lonely, you can have an increased risk of developing depression and anxiety. One review specifically for depression had found that the odds of developing depression had doubled among those who were more lonely. Another study had seen how loneliness and social isolation among adolescents increases your risk of depression and anxiety, and even up to a long time later, up to 9 years later, that risk had sort of remained there. There's also been a lot of studies done showing the link between lack of social connection and suicide risk. So one had shown that the probability of dying by suicide more than doubled among men who were living alone. For women who lived alone, loneliness was associated with hospitalization for self-harm. Other studies had shown how social isolation and loneliness for people in like long-term care facilities, cancer patients, adolescents, can be associated with suicidal ideation, possibly being due to like a low sense of belonging and perceiving themselves to be a burden. So I do want to acknowledge, I mentioned it probably very briefly a couple of things, but there are a lot of limitations to the research that exists for social isolation and loneliness. Among studies, there isn't really like a consensus on which item we're going to study. So some studies are on social isolation, some are on loneliness. There's also a lack of standardization in questionnaires and measurement. So every study, it's kind of difficult to compare because it's comparing apples and oranges. There's also a lot of layers to this issue, making it very difficult to isolate one factor to study. Some studies also are from abroad, but of course, with every country, there's different healthcare systems. So it would be sort of difficult to see if we can draw the same conclusions within our American health system. And technology is evolving very quickly. And I think the research behind that is there's always going to be a little bit of lag too. All right, so now we're going to go into talking about relationships. We're halfway through our presentation, so if you want to take a quick cleansing breath, a quick stretch, and think about some of the things that we have talked about so far, and prepare to hear Jeremiah talk on the second half.
Yeah, so maybe just a little, oh gosh, I'm gonna move in my chair a little bit. While we're, thanks, Erica. While we're settling back in for some more of us talking, thanks for your patience. Maybe I'd love to hear just a little bit from anyone in the group here. So we're gonna go into the power of relationship, part of the nature of loneliness, to then talk about how we can to better inform and talk about how we can help people with to form relationships and combat their loneliness. So I love to actually think about like what are the roots of all of this, and so if I could just I'm just gonna pose this question, like what do you guys think about why do we have loneliness? Like why does that exist in our human psyche? So I'd love to hear someone unmute and give me an answer, but also if you want to throw it in the chat, that's fine. We do have it here. Oh, yeah,
Dr. Kiefer has some thoughts, Jeremiah.
great.
Great question, Dr. Shaw. I mean, that certainly we could spend hours probably debating that.
For sure.
And I don't know that it's necessarily in our human psyche. I mean, having worked with people from other countries, and especially even last summer, we had a Shapiro student that looked at social isolation in the Latina community and found there are so many approaches to community and family that exist in other cultures that are different from what we have in the United States. So it seems like some folks have settled on some neat solutions and some neat foci that are different from our independentness here in the United States. So there's that aspect to it that I found pretty fascinating, which might lead us to a solution even.
Yeah. Yeah, thanks, Dr. Kiefer. I think that's a fantastic point that the way that we interact with each other is very different, culture to culture, whether that's the yeah, just the difference in the interactions themselves. That's a difference in society, supporting different forms of interaction. Yeah, so that's a really good point. Is that actually uh, yeah, so sort of in everybody. I see some people in the chat are talking about this being connection being this or yeah, the need to connect, the desire to connect being inherently part of our being. That there's more protection in groups, kind of thinking evolutionarily. Yeah, innately social. Yeah, loneliness serving as an impetus to connect socially. Yeah, I love all of these. These are all really good points. So let's talk a little bit more about that. And you're totally right. This is not an exact answer. I'm going to talk a little bit about evolutionarily. One theory about this is what was just mentioned here, that right way back in the day, it was advantageous to our survival to be in community. Right, it gave us the chance to divide tasks. We didn't have to do every single thing. Hunters and gatherers, to pool the resources between hunters and gatherers, to be better protected from the environment and from um, predators. All of those things made it advantageous to our survival. And thinking about natural selection, the people that could be in community were better surviving. And then on the flip side, right, thinking again evolutionarily, which is just one theory, um, being separated was harder, right? You had to do everything. You had to do all of the tasks, expending more energy to survive. You were at greater risk, greater exposure to the elements and predators, less resources. And so, right, it naturally makes sense that to survive, you had to be on higher alert. You had to have, for example, more cortisol. Um, and so we see, so what we can see today is that people, when we study people who are lonely, we see higher baseline levels of cortisol. We also see in response to stressful events, people who are lonely to have a greater increase in their cortisol. Perhaps this is a remnant of sort of the isolated state, needing to be in high alert for that higher energy expenditure, higher survival. Um, and conversely, actually, we can study people who are socially connected as when they have their deep, meaningful connections, releases of oxytocin, releases of dopamine, reinforcing the good feelings that we get from connection. And I think someone mentioned too, sort of loneliness being this factor that drives us back to social connection. I think that's a really good point as well. That's right. A lot of our, again, kind of thinking about things being all meant in some capacity to support us. That's probably how things develop for us. Yeah, the sensation of loneliness, the discomfort that we get from that, being this driver meant to kind of drive us back to the safety, to our social connection. I think in the acute sense, makes total sense that would be advantageous and helpful. In the chronic sense, is perhaps where it gets to be causing all of our health outcomes that Erica was mentioning so far, that chronic loneliness, that chronically high stress state, high cortisol pumping through our body, increasing inflammation, as was mentioned, perhaps the source of the health, the detrimental health aspects. So okay, so clearly being isolated chronically is really it puts us at a lot of risk. It's really challenging, and we could feel the discomfort of loneliness that drives us back to connection. So why then is it so hard to connect? I want to dig a little bit into some of the psychology of loneliness, uh, of that makes it so hard to connect. So the first one being shame. So there's this fear that develops that we perceive being connected, being socially connected as a good thing, and to be not connected, there's this fear of, am I socially deficient then? And if I were to reach out to someone, would I then be perceived as socially deficient? Are they gonna find out that I'm actually, there's something wrong with me? So that fear develops, that shame develops. Additionally, this heightened alert state that we've been talking about is right, perhaps this remnant of being in danger when we're socially isolated, but as a result, this being on alert, it lowers our threshold for identifying danger, right? If we think again about like just for our need to survival, when we need to survive, we have to identify danger. We need to be on more alert for that. And so as a result, we identify, right, even benign things as dangerous. Even people who are trying to connect with us and reaching out to us, we might end up distrusting that and not, being like, oh, maybe they're just pitying me. They don't actually want to be in this interaction right now. So it makes it so hard to connect even when you're kind of right in front of someone. With this alert state, again, thinking about how that was a need to survive, a need to preserve ourselves. The focus, the internal focus shifts to the self on how are we going to survive this moment to moment, and that makes it hard to connect. Even when you're in an interaction with someone, the self-preservation makes it hard to connect to connect with that person. So a couple key factors there, and then perhaps one of the biggest ones of why it's so hard to connect. The longer you're lonely, the more your self-esteem is eroded. You start to believe that voice in your head. You start to believe that there is something inherently wrong with me. There is something inherently unlovable or unlikable in me. And you start to think that you're not even worthy of social connection. Oh, and that just, wow, you can feel that it really cuts deep. And that's what people are dealing with when they're dealing with their chronic loneliness. And that's why it's so hard for them to want to reach out, or but one theory of why it's hard to reach out to people. I just wanted to mention this is a little bit different, but some interesting studies that are done on like public transit. So we've talked about how our species is driven to connect, and yet in most public transit, and I guess I'll add here in the U.S., right? I think as Dr. Kiefer was mentioning, this is very different around the world. But let's focus here on the U.S. that. Most people are not talking to each other, right, on public transit. They're head down in their technology, just getting through things. And we have this tendency to have this predictive fear about connections. So when they surveyed people, they said, I'm gonna have a better time on my transit if I am just left alone. Nobody approaches me. And that if I were to approach somebody, they would be caught off guard and they would have a worse time because of it. And then they randomly approached those people and found that, in fact, the people who were randomly approached by a stranger on their public transit, they actually reported being happier. They reported being less sad. They reported having a better commute. And so now it's a little bit different because these are kind of what we call weak connections, not like trusted people long term, but actually even these weak connections seem to have a benefit to us. And so, yeah, just a commentary, kind of an upshot here that all of us probably do this sort of prediction, whether we're lonely or not, do this prediction that if we reach out to someone, we're going to be perhaps a little bit of a burden to them, perhaps we're bothering them, but everybody actually really desires that connection. Even if they predict that they would not desire the connection, if they do have that connection, they're going to appreciate it. So just something to file away. All right, so wow, we've talked about some really challenging factors here of loneliness and the psychology of loneliness, the shame that develops, this high alert state, this erosion of self-esteem that makes it just an incredibly hard mountain to climb. So what I want to say about this is that it can't just be this passive thing. Relationships have to be this active pursuit and a thing that we can intentionally pursue for ourselves and, of course, intentionally pursue with our patients. So let's talk about how we can do that, how we can actually heal, and it's through connection, of course. So first things first, maybe let's talk about how to identify it. There is not an official screening recommendation, in any of, or I'll say in any of our kind of US-based societies. Even though we have tons of evidence, as has been laid out so far, tons of evidence that it negatively impacts our health and that connection positively impacts our health. We don't have a recommendation for screening, and largely that's because we don't have the evidence-based intervention to go from A to B, to get from isolation to social connection again. There's lots of studies out there, lots of proposed studies, but we don't have anything that's definitively, this is the thing that gets us from A to B. Now, we want to bring this up because this is an inherently personal issue, and we're going to talk about it, that probably a big challenge of this is that it's different for everybody. The answer is different for everybody because everybody's loneliness, everybody's, and the things that are meaningful to them are different. And so, we'll talk about that. The National Academy of Medicine has suggested that we should screen at-risk populations, which we'll talk about here. And Erica kind of mentioned earlier, so people who are at risk, older adults, actually younger adults as well, people 18 to 24 are also at really high risk. Rural communities, minorities by the nature of the fact that they don't see as many of their in-group, that can be very isolating, as well as all the other groups that we talked about earlier. As well as now we talk about transient loneliness is okay, but people who might be at risk for chronic loneliness would be people who have had big life transitions. We mentioned our patient who had a family member or had their loved one die. Uh, or people who might be having significant health crises, or even just people that are just struggling to have management of their chronic disease. So you can imagine this is a lot of people, right, that are at risk for loneliness, and I think the numbers reflect that there are so many adults that are walking around with loneliness that hasn't been named or identified. So how might we screen the people that are at risk? So the UCLA, there's a 20-item scale. It's actually been around for several decades and has been studied and is effective for identifying loneliness. It's a little bit cumbersome to go through a 20-item scale. Recently, they've been trying out or in perhaps last decade, been trying out this 3-item scale, so just 3 questions to screen for loneliness that seems to correlate pretty accurately with a 20-item scale, and so can feel much easier to use in our primary care offices. And so I have that here on the right side of the screen. A pretty easy thing to throw into our conversation. So you just ask people to rate for each of the following how often they have felt this in their life. So there's just 3 questions. How often do you feel that you lack companionship? How often do you feel left out? And how often do you feel isolated from others? You can see the scale there. There's not an exact cutoff that's recommended for, now you're lonely, now you're not, but you can, but it does seem that the higher the score, the more lonely and isolated you're likely to be. In the UK, on some of their sort of national health screeners that they do annually and biannually, they use this 3-item scale, I believe, as well as actually just a direct question of how often do you feel lonely? So both of those can be considerations to use in office, and you can imagine that can be done pretty quickly, actually. Okay, so identifying, of course, would be the first step, and then just like any other diagnosis, providing some education about that, right? Educating about why you're worried about this for the person, educating them a little bit about, this is not just something inherently wrong with you. In fact, we know that the psychology becomes incredibly challenging with the loneliness, the perpetuating negative self-talk, and then of course, the belief that something is wrong. But in fact, nothing is fundamentally wrong. This is just another, condition that we're dealing with. Right. So like any other diagnosis, right, trying to educate, trying to get some buy-in into why this is important. And then because ultimately, right, they need to believe that this is important and want to work on this to make progress, like anything else that we do. So once you feel like you have that buy-in, of course, then you can begin to explore solutions. And again, like I said, this is part of the tricky nature of this, is that this is going to be an inherently very personal problem and a very individualized plan that you develop with them. And so you're going to need to, so this is going to take some time to explore what that means. We should never assume that, because we've learned some about loneliness, that is what they're experiencing. We never want to assume the nature of what they desire in their connections. Like we talked about with loneliness, that's actually a subjective experience. And so it's going to need to be them that are identifying where where some of the deficiencies are in their life and how they can build that up. And that, of course, will include their unique interests and beliefs, their unique cultural background, the way that their culture connects, and the community around them. Of course, being in integrative health, we think that the whole health model is one of the best ways to do this exploration with people. The personal health inventory can really explore what is important to them in their health. The ways that they access their health, and the things that they're thinking about to try to get back on the right path. Now, of course, they're probably going to identify family, friends, and coworkers. The relationship circle as being an area that's is a challenge that they want to work on. But also just noticing what other areas they want to work on, and we can kind of bring each of the other areas into the plan that we make with them um, uh, for their for the circle on family, friends, and coworkers. So we'll talk about that in a moment. I just want to mention, right, this is a big exploration. So practically, in an office visit, it might be, the first visit, right, they came in for something else. You kind of wonder about loneliness. You do the questionnaire and give them some education on it, and they say, yeah, okay, loneliness is an issue. Maybe you give them the personal health inventory. They get to take that home, think about things, and then in the next visit they come back kind of ready to go to actually explore that with you. So this is a longer process. So let's dive into this. Some strategies for addressing this relationship circle. So I've broken it down kind of into three sections, into self, community, and then kind of directly with others. And this they need the person that you're working with needs to sort of be guiding things, but or maybe directing things, but we can be a guide here and kind of explaining that there are kind of these different aspects of relationships that we need to explore. And actually every relationship is right, a relationship is between two people, and one of those people is the person experiencing this. And so actually starting with the self, starting by reconnecting with the self is going to be a really key component to breaking out of chronic loneliness. So there may be many different strategies to connect with the self, and so we'll go through just a few. Self-compassion is perhaps one of the best in at combating chronic loneliness. This is not a selfish act. In fact, it's the foundation of how we can form our relationships with the world. Dr. Neff, who studies this so extensively, I think said this really eloquently, that it's kind of broken down. It's motivating ourselves with encouragement rather than criticism. And that's something that really resonates with me, kind of flipping that switch from the negative self-talk to a positive voice. Dr. Minichiello, who led us through a self-compassion practice this morning, mentioned, so there's kind of three components of this. This is, of course, a big topic. I'll just briefly kind of mention the components today, but there's a lot of research and thought into this. But briefly, it's self-kindness. It's countering this tendency to tear ourselves down. It's noticing when the voice in our head says, I've messed up, I've done something bad. And the practice of it might be imagining if that same situation that's led you to those thoughts, if that happened to somebody else, right? We did this morning. If it was a loved one who had this same situation, would we be telling them that they've messed up and that they're bad? No, of course not, right? You would tell them that you love them and it's okay. And so kind of helping sort of put it outside the self then helps it to translate to the self, that kindness. Common humanity. We have a tendency to wonder, why me? Why is this happening to me? And if we're able to look more deeply at suffering, recognize that suffering is an inherent part of the world. There are challenges in life. There are always going to be challenges in life. That's going to happen to everyone. This, recognizing that the challenges in life are universal, helps you to be less startled when those challenges do come up. And then finally, mindful awareness. which again we talked about this morning, being aware of your relationship to your thoughts, your relationship to pain, your relationship to suffering, not forcibly trying to change it, not trying to cling to it, not trying to resist it, just being aware of it, and that can help to understand that this too will pass. And like I said, there's a lot more to say about that, but we'll keep moving here. But it has been shown self-compassion leads to improvement in well-being, improvement in and as Dr. Neff says, psychological flourishing, which I think is a lovely term. There's a lot of nuance to that, and so you don't have to right be getting into all of that with your patient. You might just be introducing that this is a really powerful thing, and something like the Center for Mindful Self-Compassion might be a place to further explore this. This is a place that has lots of guided meditations and education about self-compassion. We'll try to throw in some practical components here too, and then we'll talk about that at the end. Okay, so other ways to connect with the self. So we've talked about this low self-esteem, this lack of self-compassion, this maladaptive thinking is a big part of why it's hard to break out. And so, you know, a referral for therapy for CBT might help combat maladaptive thinking. Now, again, loneliness itself is not, you know, this mental health diagnosis that needs to be addressed, but there is this maladaptive thinking that develops that certainly can be addressed and benefited in you know, things like CBT. Or maybe someone's not ready to talk about mindfulness. You get the sense that that's going to be a little bit too far out for them. Maybe just suggesting this like intentional solitude. Can you spend 5 minutes outside? Can you spend 5 minutes just sitting, listening to the wind in the trees, looking at the flow of water, feeling the wind on your skin, which of course we know is mindfulness, but you know, may seem even more accessible to someone just getting into this and trying to figure out how do they reconnect with their self. Okay, so we talked about different strategies for connecting with the self, and then how do we connect more broadly with the community around us? Again, this is still not directly right forming new relationships. These are going to be kind of indirectly getting at loneliness. How do we connect with community? This is kind of the next area. This can actually be anything, and so this can also be very individualized to the things that they bring up, right? So somebody who in their whole health, personal health inventory, they mentioned, I want to be more active. Great. Do you want to join a fitness class at the community center? Doing a sign up for some class or some walking group, something like that. Or maybe they identified that, you know, I used to love going to shows or going to the theater. Awesome. Do you want to go go to the local theater, see what's around? And so I just listed a bunch of examples here, right? Go join a community garden, take a class, teach a class. Is someone, did they express that, you know, when they pray at home, that's a really powerful experience, and they that's really important to them. Do they want to go do that in community? Do they want to pray with a spiritual group, a religious group? Right, this can be this can really take any form, and I think this is the part that one of the many parts that can be very individual. And when they're deeply disconnected, it might be impossible for them to come up with ideas on their own. And so this is definitely where having some suggestions already in your head can be helpful. And so I think it's really important to know some organizations in your community. You don't have to know all of the places that you can connect, but maybe some organizations themselves that do a lot of connecting. So I mentioned here places like Goodman Community Center, as well as try to make culturally appropriate recommendations as well. So places like Centro Hispano or the Center for Black Excellence, places that communities of all shapes and sizes and are already gathering. And having events, having volunteer opportunities, places that you can direct them to look for events and connection. So other ways to connect with the community. So there's the very, very general do anything. And then you can make some more specific recommendations though around volunteering. This is one of the most powerful ways to combat loneliness. It impacts all 6 aspects of well-being, including our self-esteem. And that is one of the keys that holds us back, right? Is that erosion of self-esteem. And so when we volunteer, we connect to the people that we're helping. We're passively connecting to a similarly minded peer group. And we're showing ourselves we do have self-worth. We do have self-efficacy and value in this world. And so again, it might feel abstract to people of, well, how will I ever start volunteering? And so being ready to offer opportunities in the community can be important. Now, if you have no idea what's available, just refer to social work. Absolutely, they can connect them with opportunities. And there are a lot of centers that focus on connecting people to volunteer opportunities. So United Way, right, a national organization that helps connect people to a variety of volunteering opportunities. And then, of course, the community centers, Goodman Community Center, Centro Hispano, both have volunteer opportunities that can also be connecting them to within their culture. And this can also be individual. So thinking about what matters to them. Is food and nutrition a way they access their health? Do they want to volunteer at the food bank? Are animals a thing that they love to be around, to be involved with, which yes, probably. That's for most people. Maybe you volunteer at the Humane Society or the Heartland Farm Sanctuary, all ways to get involved. So again, looking in your community, seeing what's available, even just having a couple ready to go that you can offer immediately to people. Some other way, and so that's connecting with community. This final step is, well, maybe what we're ultimately getting to, but important to address the others first. How do we connect deeply with others? Those one-on-one relationships. This can take many forms. Again, it can be exploring what are the positive relationships in your life and the negative ones. How do we give more energy to the positive ones? How do we strengthen the positive ones? So it doesn't always have to be going and making new connections, right? Most people can identify a few relationships, even if they're not as strong as they used to be. A few positive relationships, encouraging people to make those connections, to establish those connections with more strength. Maybe it's going back to those connections and saying like, hey, can we make this an intentionally deeper connection? Can we, still have fun and catch up and be silly, but can we also promise to be fully open and honest with each other? Maybe we said this. It's not a passive thing. In relationships or this active pursuit. So setting up some of those conversation agreements can be helpful. And perhaps this is a space where you can even share some information about the transit studies that all of us, we do this predictive fear that someone's not going to want us to reach out, but in fact, we all appreciate being reached out to. And some people still might not be ready to connect. And so there are other ways to form meaningful connections. Connecting with animals has been shown to actually meet a lot of our emotional needs. And so maybe that's adopting a pet, although that can be a lot of energy and money. Maybe it's just fostering a pet. Maybe it's volunteering at the farm sanctuary, any of those things. And we don't have time to get into this too much, but the therapeutic relationship with the healthcare team is hugely important. In one study with veterans that had suicide attempts or were at high risk for suicide, what they identified that they wanted most was actually empathy and compassion from their healthcare team. Taking the time to listen, to have these conversations, it really matters. It really can impact loneliness and, as a result, their health outcomes. All right, we're almost out of time. I'm just going to really briefly go through this, but we should be prescribing this to people. It's really impactful when we tell them this is an important thing to your health, and this is how I might suggest going about this. I won't read all of this. This is all the stuff that we kind of just talked about: connecting with the self, connecting with the community, and then actually directly building relationships. And again, remembering not to assume their experience, but perhaps making suggestions that are also culturally appropriate, whether that's within the Black community, Latino community, the LGBTQ community, and knowing resources that you can refer to there. And if you don't know, that's okay. Connect to social work. All right. I think maybe we won't read all of this here, just so we can get time for just a couple of questions. But in summary, loneliness is a big issue. There are some screeners that you can use, and there are a lot of strategies out there to address it. Whole health might be one way to do that. I do want to bring up for people within the UW system, we did kind of do a summary of this into a dot phrase, IH loneliness. that you can search that has the screener in there as well as who to screen. And so, if you're in your visit and you're like, man, I think I went to that presentation, they said like I should be screening people. Who was that I should be screening? And what was that screener? Just pull this up really quick. You can just ask those couple of questions to them. Here's an example of a treatment regimen that you could consider. And then even below this, there's an example of like some patient instructions that I might consider, including links for compassion practice and community resources like those that I already mentioned. All right, I'll stop talking now. Thanks, everyone.
Thank you, Jeremiah. Thank you, Erica. Gosh, as you were talking, I thought of so many patients that this is applicable to. I remember back in residency, I had a Hmong patient who she just had there was just a darkness to her, and I told her about Kashia House in Madison here, and like every time I saw her after that, like she thought I was the greatest doc in the world because I mentioned that, and that was like all I ever did for her, and it made such a huge impact on her sense of well-being. And so I think having us be aware of resources, and I want to make sure that folks look in the chat and see that Shelley Shaw has given us a resource, as well as, gosh, a couple of resources. Shelley, thank you. And Lisa Thomas Prince also pointed to some guided self-compassion meditations on our UW Health mindfulness website as well. Shelley, do you want to just mention sort of the Wisconsin Coalition for Social Connection? Do you have any more information on that, Shelley?
Sure, and really sorry, I'm having troubles with my buttons here. Really appreciated this presentation. It was amazing. Yeah, the Coalition for Social Well-being, again, came out of COVID. I think really started in partnership with long-term care facilities, as you kind of mentioned. It really impacted folks in those settings, but has really expanded beyond. So I think it's a neat group to be a part of if you have time to join the coalition. But there's information for professionals, but then also a lot of resources I think that you all really recommended as well, but in one, in the website, in terms of connect strategies to share with others in terms of connecting with others. So and they also have a regular newsletter that you could sign up for. So
Thank you.
Yeah, thank you. Yeah, and I hadn't seen that in particular, but yeah, that's awesome that exists, and yeah, we'll look into that as well. I was just seeing as well. I think Dr. Bear was mentioning that we are actually using or doing research with the 3-item UCLA scale here. Dr. Henningfield and Schrager are doing this, and so that's awesome that we're doing that.
Yeah, it's a small grant for our department. Serena is one of our physician faculty, and Mary Henningfield runs the Wisconsin Research and Education Network, or WREN, which is in our department. And they'll be doing a report and publishing on this, and hopefully coming up with some guidelines. What they're doing is trying to figure out why current clinicians are using it, how they're using it, what might be useful, and then maybe turn that into some guidelines for the larger system. The 2,300 patients that were found who'd been screened were in general internal medicine and family medicine, so in primary care clinics, and more information coming.
Yeah, that's fantastic. It's so interesting as we went through this, right? That there's so much evidence that this is an issue, and yet there's just not a lot of guidance out there. And so that would be awesome to be developing guidelines of how we can do this even better for our patients.